Hello, good morning, welcome. Today we are talking about all things skin. So for the past few weeks, we've been covering face, acne, hair, all of that good stuff. And today we're going to talk about like general skin issues. So it can be scalp, face, all over your body. There might be something going on that you need to be clearing up. So the most common thing that I see is eczema or psoriasis, which can look like red, dry, scaly patches. Sometimes it's really itchy, sometimes it's very painful. Most of the time the skin is very flaky. I would say scalp psoriasis would be the number one most misdiagnosed condition that I see because it looks like dandruff and people go, oh, it's just dandruff, and they're trying everything for dandruff, but it's actually patches of psoriasis on the scalp. So with all skin well, I shouldn't say all, most skin conditions like eczema, psoriasis, pilaris, they are actually food sensitivities. And this is usually when I run into a lot of resistance with my patients, and that's okay. I understand. But getting rid of foods that cause flare ups are going to be really important. And for some people, within 4 days, they'll see a difference in their skin clearing up. And some people, it might take a month or even 3 months. I've seen as long as take that. So eczema, I typically see as a gut condition where there's either an overgrowth of opportunistic bacteria, there's not enough good bacteria, there's some type of inflammation or leaky gut. So for eczema, cleaning up the gut is usually the most important step. I like to run the GI map stool test to make sure that everything's in balance, that there's no infections or parasites or worms. We can even test for viruses. The other thing it looks at is the immune system and how well you're tolerating foods, and it gives us a really good overview of what's going on with the gut and your hormones as well. It's an awesome test. The psoriasis issue tends to come more from the liver and having backup in the bile or overload in the liver. So when we clean up the liver, the psoriasis tends to clean up as well. So those are my main key points and the differences as well. So if you find that you've been treating your gut this whole time and nothing's clearing up, it might actually be psoriasis and you need to switch your tactics a little bit too. For both eczema and psoriasis, I like to use essential oils because they can be supportive. Sometimes it's a Band-Aid support where it's getting rid of the swelling and the redness, which is great while you're working on the inside. So things like geranium oil, lavender essential oil are great topics as well. We can use the Immortelle blend, or frankincense can be very supportive. So kind of have to play with it and see how your skin responds as well. Psoriasis can be an autoimmune condition, so we have to focus on the autoimmune aspect. So testing for that, seeing which system is being attacked and what's triggering it. Is it mold? Is it toxins? Is it environmental? Is it infections? There's so many things that we can go down this road with, but it's a good idea to keep in the back of your head. Now, eczema and psoriasis can also be a side effect of medication. So if you're taking medication and all of a sudden you have these new rashes, that might be something that you need to either adjust with your provider or switch medications or get a new prescription to deal with it. So just something to keep in mind when you're dealing with this. Keratosis pilaris, so chicken bumps on the skin. Most people get it like on the back of their arms is really common, and on the thighs. Looks like chicken skin where it's really bumpy. That is most commonly is a gluten intolerance. So gluten, dairy, soy, and corn are the most important foods to get out of your diet because those are the most triggering. There's a million reasons why. My research books are like that thick on what gluten does to our body and how dangerous it is with our current farming and GMO processes. So yes, you can go to Europe and enjoy bread and come here to America and it will give you some trouble. And there's a lot of reasons for that. But I would strongly suggest taking it out of your diet and again, give yourself some time. The reason why corn and soy are on that list is because of molecular mimicry. So what that means is our immune system is incredibly smart, but it doesn't always discern differences, which is why autoimmune conditions are so prevalent as well. So gluten is just a very common, is a very, very large protein, very large molecule. So the protein that makes up soy or corn can look like gluten. So our immune system's going, okay, here's gluten and I've tagged it and I know I need to attack it when I see it in the body. But this corn, I don't know, this looks pretty similar. I think we should group it together. So every time you eat corn, you're actually getting an immune attack or food sensitivity, which can build up into an allergy. So this is why food sensitivity is when you start with one, you're like, oh, I can't eat gluten, or well, it's kind of, I can't have dairy. And then all of a sudden you can't have this food or this food or this food. And just all of a sudden you feel like you're at the end and you can't eat anything. So that's why we have to clean up the gut and take care of our leaky gut and monitor our stress and improve our vagal signaling throughout our body. It's a big, big project to work on, but it's so worth it. And especially for your skin, and you want to be able to dress the way you want to dress without pain, without irritation, and feel good in your body. Cleaning up from the inside out is really important. I know that it's really tempting to just grab every cream or prescription or even essential oil or supplement and just pile them up and just put them on your skin and hope that that will take care of it. But the reality is the skin is an expression of what our body is feeling and experiencing, and we need to acknowledge that and take care of that as well. So that, I think, are the three main ones that I wanted to hit on today. Next time I want to talk about histamine and flushing and redness and swelling, because that's a really big topic as well. So if you have any tips or tricks that you love to use for eczema or psoriasis or your skin, I would love to hear them. There's so many. What works for you, what you've enjoyed, what hasn't worked, I would love to hear it and share with everybody so we can really build a community based off of this. And we'll see you next time. Thanks for tuning in.